I'm going to talk you through how to use the AED, so the automated external defibrillator on a baby. So I'm using a trainer AED, so it's not actually going to deliver a shock, but it will mimic what a real AED does. What it also does is slightly slower than a real AED because it gives us a chance to explain things that need to be done in between. If you're already doing CPR, minimize the disruption to CPR. If you haven't started, you place the pads and listen to what the AED is saying. Remember, obviously with children and babies, you want to give them 5 rescue breaths first. Usually, if it's a respiratory problem, which commonly it is, you'll probably be able to get them back. But if not, obviously carry on with chest compressions with your AED and rescue breaths in between. So we'll open our AED. In this case, we already have the pediatric pads attached to the AED. And what I'm going to do now is to switch it on so that it gives me instructions, and I'll follow the instructions. Remember, there will be some slight gaps, and we'll fill in those gaps with some additional explanations for your benefit.
Open patient. Stick electrodes on the patient's bare chest. Stick electrodes on the patient's bare chest. Stick electrodes on the patient's bare chest. Do not touch the patient from now on. Analyzing heart rhythm. Shock not advised. Patient may be touched. Carry on resuscitation. Alternately, give 30 chest compressions and 2 mouth-to-mouth breaths. Now give 2 mouth-to-mouth breaths. Now give 30 times chest compression.